So, good morning to all the viewers from India, and good afternoon to those who have joined us from down under, including our very special guest today, Dr. Louise Phillips. Welcome to day 3 of India's first low-carb focused metabolic health conference. This first session of the last day is going to be insightful and delightful because we are blessed to have a very charming Dr. Louise Phillips, a doctor who trains the doctors. Dr. Phillips is a woman with many hats. She is a family physician from Albany Creek, Queensland, Australia. She is a senior lecturer at the University of Queensland. She is a supervisor and external clinical teacher approved by the Royal Australian College of General Practitioners. She is a certified practitioner and lead educator at Nutrition Network. Most importantly, she is also the founder of a unique and resourceful platform, Low-Carb Scripts, designed to help health professionals on different aspects of prescribing low-carb for metabolic health. Today, she is here to speak mainly about attracting doctors into low-carb medicine. Thank you so much, Dr. Phillips, for joining us today.
Thank you so much for having me. That's a wonderful introduction, and I'm really looking forward to being here today.
Thank you. So I know that you are ready with the presentation for us, but before that, can you please briefly tell us about what made you take this road less traveled and go down the path of adopting and advocating the low-carb way as an intervention, rather than the still mainstream, widely used pharmacological intervention for metabolic conditions?
Yes, so personally, I've got a very strong family history of metabolic dysfunction. So my mum has type 2 diabetes and my sister has type 2 diabetes. And I was an enormous baby when I was born. I was 5.45 kilos, which that alone increases my risk of diabetes 6 times. And as a doctor, it's somewhat demoralizing to just see patients get sicker and sicker. And during the COVID pandemic, I had started to gain a little bit of weight just with a few extra carbs from the stress of the pandemic, basically. And I heard a podcast by Dr. Peter Bruckner, and he mentioned reducing your carbs and losing weight that way. And so I did reduce my carbs and I lost weight. I wasn't hungry for the first time in my life. And I just started to study it. And I have studied it now for probably thousands of hours. And I undertook the certification pathway with Nutrition Network, which was the hardest course I've ever done. Very, very worthwhile, but a very difficult course. And I just believe that to help more patients, training clinicians in how to prescribe low-carb medicine enables you to help more people, basically. And metabolic disease is so reversible and so preventable that it's a major target for me.
Yes, true. Thank you so much for sharing this background with us. Now, may I request you to please share the presentation and your insights with us that you wanted to share during this session?
Yeah, for sure. I'll just share my screen now. And yeah. And I'll just start it as a slideshow from the beginning. So essentially, with how I think we should recruit doctors, I think we need to take into account a few things that people need to know about training doctors and also about teaching patients. And I'm going to start with looking at some misconceptions of patients about what they think their future health will be. Have a look at what barriers there are currently to doctors who want to prescribe nutrition, how doctors actually learn in the postgraduate space, and also have a look at how people in general learn best. And then taking all this into account with a solutions-based approach, I'm going to point out an opportunity that I think exists for teaching doctors and also other allied health professionals. So a lot of people think that retirement's going to look like the picture on the left here. So wonderful time spent with family, the grandchildren, lots of health, when in fact the reality is that it looks more like the pictures on the right. It's full of lots of medications, lots of ill health in hospital, and also family having to care for sick family members, and really quite a difficult time at the latter part of life. And as a GP, this is what it's like for me. So I initially get to look after lots of wonderful, healthy people. The babies and the toddlers and the teenagers and the young people come in and they're like these healthy sailing ships on the left. And by the end of their life, they're looking like these rusty hulks on the right-hand side. And that's because they've got so much chronic disease. And I'm trying to patch people up with medication that doesn't work very well and Band-Aid solutions. And that's really hard because I became a doctor because I wanted to help people. And so GPs, do have a power to change patients' health trajectories, but you really have to have the right target and you have to have the right intervention. And I strongly believe that the right target is metabolic disease and the right intervention is low-carb nutrition and fasting. So it's important to recognise that prescribing nutrition is actually a complex intervention. Even though the advice itself is quite simple, it's working within a very complex system. So you can see that the patient has their own mental health problems, they've got their own diseases and comorbidities, they're affected by their sleep, they have to attend social events and work, they live within families, they're under the influence of media and social media and peer pressure, and of course there's addictions, including food addiction. Whilst GPs are under the influence of colleagues, and particularly colleagues who don't really like what they're doing, there's risks of being sued or being brought up before the medical board. You're trying to operate against conflicting medical guidelines, work within very small time frames, and having a huge workload already, and probably limited knowledge and skills about nutrition, even though you've got a wide knowledge about lots of other diseases. And the family, of course, influences this too. And meanwhile, the pharmaceutical industry and the health industry is also pulling strings, and this is all within big food as well. So these are the barriers to prescribing low carb for doctors. Of course, the intense time pressures, the fact that many doctors are already burnt out from chronic disease, having to manage that as well as the pandemic with COVID. They already have to know so much information. They've got an overwhelming curriculum as it is. And I teach junior doctors and I particularly see that. They're under the threat of litigation from, from being sued by patients, but also being brought up before the medical board and deregistered and being deregistered. So they're fearful. And it's hard to be the only one doing it. You like to sort of be doing the same thing as the other people. And it's important to recognise that medicine is taught apprentice style. We learn from other clinicians. We like to learn from people who are actually doing the job and who are on the ground because they simplify it and they teach you what you need to know. And we also learn via a see one, do one, teach one approach, which means that we see a procedure being done, then we do one ourselves, and then we teach another colleague how to do one. And in this way, you can become competent in very short timeframes. If you're the resident on a cardiology rotation, within 10 weeks, you'll become very good at treating heart failure and diagnosing it, and also, treating and recognising chest pain. And most importantly, we learn through cases, we learn through patients, and this is what we remember best. So there's another strategy called academic detailing. And what this is it's a clinician going into a practice or perhaps delivering online as I do, giving brief education sessions on topics that are very relevant to that clinician. And it recognises, just like in this puzzle, that in fact, doctors and other health professionals actually have a broad range of knowledge already. You're just providing an essential piece of the puzzle for them, and it just needs to slot in there. It has to be with an evidence-based approach, and you need to give them some tools to implement it and give them some handout material. And this is what pharmaceutical reps do. They spend 5 minutes with a doctor, tell them about this complicated drug in a very simple way, and then leave behind a handy pamphlet so that next time they need to prescribe it, they know how to do it. And so low-carb scripts takes this academic detailing approach. And with patients and with doctors, with all of us, we learn via multimodal learning. You can learn best by learning in both a visual way and a verbal way. And Richard Mayer put forward this theory that's well recognised in patient education studies, that you can learn through pictures, the visual way, and the verbal way includes both the narrative, so the spoken word, but also the written text word as well. But there's only a limited capacity in both of these channels before you overwhelm it. But if you can utilise both channels, you can pass a good amount of information across and it's going to be retained better. And pictures, as we all know, really help patients to understand and help them remember. And it's the same with clinicians. So that's why low-carb scripts uses a lot of pictures. And so this gives us then something to leverage, because if we look at the blue funnel, someone may be a very highly knowledgeable doctor, and I would rate myself as this because I've studied it for so long now. However, no matter how knowledgeable I am, I have to dispense information to patients in very short timeframes in a very simple way to patients who've got a very low level of health literacy. And so I strongly believe that we can teach doctors and clinicians this essential knowledge that they need to dispense and then provide a little bit of information around it so that they know how to manage patients. They don't need to go into looking at all the research themselves. And so Low-Carb Scripts is based on this principle. The Low-Carb Doctor's Kit provides all the patient education images, the spiels, the handouts that you need to deliver advice in between 1 and 20 minutes, teaches you how to chunk it up. And the Low-Carb in a Nutshell package teaches you all this information, but it does it with short lectures that are very relevant, based on research and also based on case studies, so that you can troubleshoot, you can understand how to interpret pathology and really become very competent in this space because you know the essential things. So what we do then is that we provide effective patient education tools. We enable doctors and clinicians, any health professional, even allied health or dietitians, nurses, etc., can use our programs all over the world, and it enables them to acquire knowledge fast. I also teach you how to navigate guidelines and how to deal with colleagues. And I teach you how to run on time. And I also show you ways to reduce burnout. And I think all of these factors are needed to solve the problem of prescribing nutrition in primary care. And what I've created in honor of this wonderful conference that I'm part of is a free patient information handout for clinicians to use with low-carb strategies and fasting strategies for patients of South Asian and Southeast Asian descent, and with very specific advice of things that they can do. And you can access that at my website, www.lowcarbscripts.com, or you can scan the QR code and access it that way. And I also wanted to mention that if you are a clinician or a health professional of any type and you are working in a developing nation, that I have very special discount pricing available to make my courses extremely affordable for you, no matter what your income. And it does just require a little bit of proof that you are actually working in the country that you say. But if you contact me via email or via a form on Low-Carb Scripts, I'll correspond with you and arrange for you to have a special discount. So that's the presentation that I wanted to share.
Yes, thank you so much. That was very useful with some practical pointers and ideas. And I think it's great that you have taken these efforts to think of almost all the associated factors like time management, budget, what might be the issues related to peer pressure, etc., to make these courses and training sessions for the doctors. So how was the response for these training sessions when you delivered them to the health professionals? How often do you think you come across resistance or reluctance to part ways from the mainstream approach that they have been taking over the years?
Yes, so I've done this in a number of ways. So I've got my online training platform. So the people who come to that are usually interested in doing it already, unless they just want to learn how to run on time, and then they may become interested in low carb. I also, with registrars and with medical students, when you're their supervisor, you already come to them from a position of authority. And so you've already got a lot of credibility with them. And so I just teach them using the Low-Carb Doctor's Kit, teach them how to use the spiels and provide them a copy of the kit. So that works really well and easily. And then with registrars, I give a few lectures during the year about it. And then I help them with cases, and they've all reversed some diabetes of their own now in patients. And then I also give group practice education to my own clinic where there's about 20 doctors. And that's had a mixed response initially, but I've been doing this for 3 years now. And even doctors who are a bit resistant initially have, come around, a lot of them. And gradually over time, more and more of them are referring patients directly to me or trying it themselves and noticing that it works. And then on a statewide level, I have given a talk about lipids and CAC scores and statins, and that was to about 130 GPs across the state who weren't at all necessarily interested in low carb, and that had excellent feedback. So I think doctors are interested in it. They just haven't been taught about it yet. But with doctors who are resistant, I think you just have to roll with that resistance. I'm not interested in converting everyone. I'm aiming for the low-hanging fruit. I'm not going to waste my energy on people who are really opposed. But at the same time, if someone is interested, I'll happy to plant a seed and invite them to come back again.
Yes, yeah, I think that's a very good point, that at least try to get the low-hanging fruit first.
Yeah.
Yes, and then you are in a position where you can make the difference at the right time in the lives of medical students, so that they learn it early about the dietary interventions.
Yes, that's right. I think getting them early is very helpful. I think they're a lot more malleable, but even older doctors are interested, but they mainly want to know what are some things you can say in just a really short amount of time to patients as well.
Yes. Can you share any such example where you have already changed a practice that was based on the mainstream advice, but after your session, after attending your session, or after attending the course that you do with them, they changed to dietary interventions rather than the pharmacological ones?
Yes, sure. So, I mean, even with the first practice talk that I gave, one of the doctors stood up and said, "Look, I don't believe in all this low carb baloney, blah blah blah." But she ended up purchasing one of my low carb script courses and sort of has attended low carb conferences and things like that. So sometimes if someone does change, they can become like a really good supporter actually as well. And then even with one of my registrars at the moment, she had sort of said to me, "Oh, Louise, I've just had my first patient, and is this diabetes reversal?" And their HbA1c had come down to 6.3, down from 9 or whatever it had been initially. And I said, "Well, yes, that is, they sort of just have to maintain it for 3 months." And she's like, "Wow." She goes, "At first I really wasn't sure about all this low carb stuff, but I'm becoming converted." So I think it's one of those things that once you see it, you can't unsee it. Once you see people get well and have more energy and reverse their diabetes, you just can't explain it, because pills don't do that.
Yes, true. True.
Yeah.
It's good to know that there is change happening, even if it's at a so slow pace.
Yeah.
So, especially for a country like Australia, which has a diverse diaspora and multicultural society, how do you prepare yourself to know or to talk to the patients coming from different backgrounds, European, Asian, Indian, Aboriginal, and know their cultural backgrounds, their dietary habits, and then gradually guide them to make the changes in their diet and lifestyle and such?
Well, I think it's looking at the major commonalities, actually. So everyone has the same, pretty similar physiology, and that's that carbs cause the biggest spike in your blood sugar levels and a rise in insulin levels, and reducing carbs is helpful for that. And that you need protein and fat because that's what your body is made out of. And then it's a matter of encouraging people to, eat less frequently, just 3 times a day or less. And it's having less processed food, less stuff out of packets. And if people do have certain cultures where they have a lot of carbs, I mean, Australians have a lot of carbs. If they're of Indian descent and have rice or bread as part of their meal, they're having a lot of carbs. Asian people might have rice and noodles. So carbs are sort of there. But the good thing is everyone actually knows what the carbs are, because we've all been taught the food pyramid. So you can get people to reduce what they're having. You may not get perfection, but you're not necessarily aiming for perfection. You're just aiming for them to reduce it and to up their protein. So that's where I think, even though, and fasting, I think, is something that culturally can be very accessible for people as well. So with certain religions, they may be used to not eating. And so fasting is something that anyone can do. And it's free for everyone as well. So it helps in those sorts of situations. So I think it's just, the advice is pretty similar, but if they raise certain things, then you might just give them some other strategies. For instance, having the carb, if they must have rice with their meal, to have it at the end of the meal, and just a really small amount, like an egg cup worth of rice. And by the time they've hopefully filled up on fat and protein and vegetables, maybe they don't feel like that as much, or just having it on a special occasion only, or making sure that if they do want to have a carbohydrate, to tailor it to themselves, to check their blood sugar level before they eat and to check it 60 to 90 minutes after they eat, and to find the amount of carbohydrate they can eat that doesn't spike their blood sugar too much.
Yes. So seeing is believing. So once they see, they must be believing.
That's right. Exactly. Yeah.
So do you have any specific observations pertaining to in people from Indian diaspora? Because most of our viewers are Indians today.
Sure.
Do you have any particular observations or suggestions that you can share today with them as
Yes.
to what changes they should make in their diet? What are the policies in the current diet that they follow?
Yes. I think one big one would be to make sure that they're having healthy fats. So the healthy fats are things like butter and ghee and lard, the fat on their meat. They're fats that humans have been used to eating for eternity, instead of the seed oils and vegetable oils, which no one even knows how they make them and are very foreign to our body and cause a lot of inflammation. So just making sure they're cooking in the right fat. To choose, if they do eat meat, to choose the fattier cuts of meat, because that helps them to feel more full as well, and it's more budget friendly as well. If they don't eat meat, then it would be preferable if they could have protein of some other sort with their meal, such as eggs or cheese or paneer or things like that. And if they don't have any of those things in their meal, if they really are just having fully vegetables and pulses and lentils, to just be aware that the lentils and the legumes do have a lot of starch in them, and that will make their blood sugars go up a bit. But it's certainly not as the first thing to cut out would be things like soft drink and juices and sugars and packet foods. They would be the first things to go. And then to eat as their culture ate traditionally. If you could just go back to a traditional diet and eat no more than 3 times a day as well, that would be helpful. And if you don't feel hungry for breakfast, it's fine to skip breakfast. You've got lots of stores on board. And keep in mind, this is all just general information, not specific advice. If you're going to be changing your diet and you're on medication, I would recommend that you see a doctor to have your medications reviewed, because there are some changes that need to happen with that. So they're the sorts of changes that I think people could make. And I think it's important, sometimes culturally, some people don't want to, they may associate weight or being overweight with wealth or good health. And they feel that if people lose weight and become skinny, that they are frail. And there's a big difference between being thin and frail and slim and healthy and with lots of muscle, so that you can do all your stuff and lots of strength. And so I think that that's just something to point out and to show them, and to point out people who are healthy and vigorous and slim versus the concept, the concept they may have in their mind of what that looks like. So yeah, I think there's some strategies that people could use. Yeah.
Yes. So along with the high amount of carbs in the diet, do you also need to deal with their fear for saturated fats in their diet? Do they ask about their preconceptions about fats in the diet, and how do you answer those queries?
Yes. So I mostly really talk about prioritizing protein to make sure they're having a good palm size of protein with each meal. And then it's fat for flavor and fat to feel full. And I don't specifically focus on necessarily saying eat saturated fats or unsaturated fats. I just talk about natural fats that you can explain in one sentence how they were made. Like you could explain how cream is made and butter is made and how the skin on chicken is made in a single sentence. But I ask someone to explain how a vegetable oil is made, and no one knows the multiple chemical steps that are involved in that process. So I think a lot of people confuse keto and low carb with eating lots of fat, but it's really about dropping down the carbs, really upping the protein and fat for flavor. Because you want to, when your insulin levels drop down, you really want to then be able to tap into your own fat stores, and they're going to be providing some of the fat to your diet and supplying you with some of the essential fat. Mm.
Yes. I think those were very useful guidance. Yes.
I just wanted to say as well, if someone is vegetarian and doesn't have other protein sources, that is perhaps a consideration for using a protein supplement as well, just to make sure that they're getting enough protein and that they're not protein malnourished, which is a big problem in certain countries and cultures.
Yes. So by protein supplements, do you mean whey protein or paneer?
Yeah, like something like that, and to just check the label and make sure it's got as few ingredients as possible, and it's got protein and not carbs and fillers and flavors in it, but they might add that to sort of food that they eat, and that will also help them feel more full. Yeah, but it is a processed food, but it's better than, I think, sugar and starch.
Yes, definitely. So I'm really glad that you provided these guidelines and pointers for the Indians who are watching this today. I'll just repeat to let all the viewers know that Dr. Phillips has shared a handout about healthy food choices, specifically keeping the Asian and Indian people in mind, on her website www.lowcarbscripts.com to support this conference. It's free to download for a limited period of time. Please visit this website to check it out and also to check out other courses that she has for the doctors. Thank you so much, Doctor, for this gesture and for having this wonderful session with us today, and wish you all the best for your future endeavors. I'd like to, yes, Shashi is here.
Thank you. Special thanks to Dr. Phillips. You have been an ardent supporter of this event right from the beginning. You have created a special download for Asian Indians, and I think that's a very beautiful, sweet gesture of you. And you have been actively campaigning and promoting it in LinkedIn. So we are so thrilled to see you, and we are so happy to have you. And your own the person staying in your own country is also hosting you. And again, I think it's really a good moment. Nice program, Dr. Phillips and Prajakta. So,
Yes.
Fine. So we can get the next guest in. Dr. Phillips, want to say anything else?
Yes. Oh no, just thanks so much for having me, and thanks for hosting me, Prajakta. That was a really fun interview, and I enjoyed it. Thank you.
Fine. Thank you, and I'm so happy to have my friend and colleague from Nutrition Network, Dr. Phillips. So so happy to see you. Thank you. So we can.
Thank you. Bye.